Hello, everyone. I found this article in Nature Medicine about Anakinra as a possible treatment for COVID-19, and someone had mentioned that in one of the comments in one of the previous videos, so I kind of looked into it, and it's very interesting. So Anakinra is a drug that I hadn't heard of before, but evidently is a drug for a bunch of different autoimmune diseases like rheumatoid arthritis and some rare diseases like neonatal onset multisystem inflammatory disease and deficiency of interleukin 1 receptor antagonist. The trade name is Kineret. And basically, this drug is an antagonist for the interleukin 1 receptor. Interleukin 1 is one of the activating cytokines, and this thing blocks it. So an antagonist means that it binds the receptor and keeps it from working. There's another thing called an agonist, which means it binds the receptor and makes it work. So this is an antagonist, so it basically blocks the function of interleukin 1. And since it's an activating cytokine, it activates your immune system. This drug is a immunosuppressant. So it's going to suppress your immune system, which seems counterintuitive in fighting an infection, but as we know, most of the damage from COVID is from your immune system's response to COVID and not exactly the virus replicating in your body itself. So this um, article, which was published about a month ago, talks about early treatment of COVID-19 with anakinra guided by soluble urokinase plasminogen receptor plasma levels. So they found that an early increase of soluble urokinase plasminogen activator receptor. So plasminogen activator is basically a protein that activates plasmin, which is one of the proteins that breaks down clots in your body. And they found out that they thought that this levels of this protein, if you measure people's serum levels, it correlated with how well they were going to do with COVID. So if you had really high levels, you tended to do worse. If you had lower levels, you tended to do better. And so what they were saying is that these levels are also increased in relation to disease progression with other markers like C-reactive. So these are all very common markers used in the hospital by doctors. When I was on the COVID ward, these are the things that we checked. We checked for ferritin, which is right here, D-dimers, C-reactive protein. And like C-reactive protein is just one of the things that goes up with inflammation. Ferritin is normally an iron binding protein, but that also goes up with inflammation. D-dimers are products of fibrinogen when they get cut up, and when clots are dissolving, they make D-dimers, and so it is also it's a marker of how much clots you have in your body as well as inflammation. So anyway, these are all inflammatory markers, and they noticed that this plasminogen activator receptor is associated with these other proteins called calprotectin and interleukin 1A. So these things are basically correlated with interleukin 1, and then so it made them think, okay, well, anakinra is an interleukin 1 blocker, so maybe we could use that. And there have been several, they're not the first people to do this. They've been looking at anakinra since like early 2020 when COVID first kind of came on the scene. Anyways, they had a fairly large study where they looked at 1,000 people, and then they looked for these markers. So they had to have high enough plasminogen activator receptor numbers. Their FiO2 had to be a certain level. Anyway, they had a bunch of inclusion criteria, and 606 of them met the inclusion criteria, and then they split them up, and it was kind of an uneven distribution between the treatment group and the placebo group. I think they wanted more in the treatment group to get better um, uh, power in their study. And so these are the baseline characteristics. So here's the placebo group, and here's the anakinra group. All right, so this just basically shows that age, gender, comorbidities are all the same. The important thing that I wanted to look at here is the percentage that had oxygen administration. So the anakinra group was actually a little bit doing slightly better. So 90% versus 94%. So that is a little bit of a issue. They were at baselines doing slightly better. and then what medications were given to them. And so you want to make sure that other than the anakinra, the medications that they were given were relatively similar, and it looks like that is the case. Looks like a large proportion of them got remdesivir, many of them got dexamethasone, and then most of them got heparin, and then these are just antibiotics. So that the treatments look pretty similar between the two. And then if you want to look at this, this is their endpoint that they figured out. So this second column is anakinra and this is placebo. So you can see that by day 28, 50% of the anakinra group was recovered versus 26%. So double the number of people had recovered by day 28. And then overall, so these are a bunch of other things like uh, symptomology, and then hospitalization with oxygen or no oxygen, need for high flow oxygen. These are such small numbers, you probably can't get too much of this. But basically, if you look at all of these, the odds ratio for anakinra was 0.36, which suggests that they'd had 60% effect. So it was helpful by one of these metrics in at least 60% of the people. The biggest being like full recovery was faster in this. So there was a more recent article earlier this month published in Lancet Rheumatology, which was a systematic review. They did a systematic review of previous studies on anakinra. They did not include this study. I guess it was too recent for them to include it in their study. But they had about 1,000 people between all the groups that they looked at. And so they looked at, let's see, 9 studies for which individual patient level data were sought. And then these are the 9 studies. I'll link both of these papers down below so you guys can read it yourself, and I encourage you to do so. Um, but basically, here is the whisker plot, and here's the line that shows no effect of anakinra, and this stuff on this side favors use of anakinra. This side favors no anakinra, and you see most of the studies, except this one study right here, favors anakinra. These 2 studies kind of sit kind of neutral, but most of them favor it. And this is the main table to look at in this paper, which is um, what the effect of mortality on this was. So if you look at the anakinra treatment, its odds ratio of 0.38 in univariate analysis, and then if they try to adjust for other factors, it's 0.32, so even a little bit better. So it looks like it improved mortality by over 60% in patients that have been treated with anakinra. So this is very interesting. It seems like this is very recent data. I suspect that with this is a randomized control study, and this is a systematic review. So fairly large randomized control study showing benefit, and then some systematic reviews also showing benefit. I suspect that people will start using anakinra fairly soon. At least a few early adopter physicians are going to start using it because the data seems to be relatively robust. Um, the only issues are like anakinra is an expensive drug. Also, it is an immunosuppressant drug, so it's not benign, and so has some potential serious side effects. It could make people more susceptible to secondary bacterial infections after COVID, and that is a legitimate concern. But overall, if taking all those into account, improvement in mortality was over 60% across multiple studies, and then symptom control was over 60% in this study, guided by urokinase plasmin activator receptor levels. And so this is probably something to consider, and I'm thinking this is going to become part of the standard of care at some institutions, and depending on how things seem like they work out in the real world, we'll hear more about these things. I don't know the cost structure of this. This would definitely be off-label use, but there is some good data to support it. So I don't know if you guys have heard of this Anakinra or um, what you think about it, but the risk benefit profile appears to be fairly good, and I think it's going to become something that places are going to start using fairly soon.